See if anybody's going to jump on. There we go. Somebody jumped on. How's it going? Down at the shop last week, so decided to be in the office this week. It's a little bit cooler. Hey, Jeff, how are you, sir? It's hot, so it's hot here in South Carolina today. It's been hot this week, so nice heat wave coming through. Figured I would get on to a live chat. Got some yard work to do, but live chat last week went well, so we'll see how this one goes this week. If you could hit like the thumbs up button for me. So dad question mark. I'm not sure what you're asking there, RM. New York City, awesome. Glad to have you. Hopefully the weather's a little cooler up there. So Aiken, yep, not far from me. Yeah, I've got to go cut grass and do like real chores. Awesome. How's everybody's week been? Any recommendations for a newbie? So James, like I would say, get some education, get some classes, take a first aid class, take stop the bleed course, and get some education first. I think that's important because you can have the equipment, but if you don't know how to use it, then I think kind of letting yourself down a little bit there. So get some education, stop the bleed class, first aid class, and then a basic boo-boo kit will do a lot of things, Band-Aids, ointments, stuff like that. And then tourniquet, gauze, pressure bandage, chest seals, all that stuff will come in time. But we use a lot of Band-Aids, a lot of ointment, burn cream, bite and sting pads. Like those are all important. So, but having some education there, it's a first aid kit would be good for you. Good question. Anybody else? No tampons. You can carry tampons, but you would use them for what they're intended to use, be for your wife, girlfriend, daughter, something like that. But not for deep wounds, no. You're not absorbing the blood, which is what a tampon is there for. So probably okay for a nosebleed, but that's about it for as far as first aid. Anything else? What else you guys thinking about? Make sure you hit the thumbs up for me in the video. So at least YouTube is pushing more of these vertical live. So make sure you hit the thumbs up button for me. Sold birthday kit years ago, possibly selling. No, not really. No, we do have an OB kit, but the OB kit is just kind of what they keep on your ambulances and stuff like that because it's from Dynarex and they sell a lot of ambulance supplies for that. So we do sell an OB kit, but it's not the midwife kit we were selling. So it was just really hard to piece all those together, make that kit. So we decided not to do it. But we do have an OB kit, and it's what's on every ambulance in America is that OB kit. Typically, the same supplies. So, but the midwife kit, no, we're not going to sell that anymore. It's just it was difficult to piece all the pieces together, and it was hard. Got a 308. Do you see holding value? Yeah, I think guns are always a good investment. At least that's what I tell myself anyway. Typically, a firearm's going to hold its value. So, as long as my wife doesn't sell it for what I actually paid for, I told her I paid for it versus what I actually paid for it. Sergeant Benjamin, hey, how are you? Thanks, Jeff. That was a good question. My good hope. I am having a good weekend. I'm not on call this weekend, so I was on call Friday. Was out in the heat, so but I'm good. So I just got to go work on some yard work. So I think I'd rather be on call running calls and sweating on a lot more. So yeah, Jeff, I hate to say it, but yeah, looking for the OB kit. That's what I would do. I would just pick up our OB kit at Medical Gear Outfitters. I don't know. I don't know where the thumbs up button is for you. Thanks, Sophie. Yeah, I saw a picture of Prep Medic was flying over the mountains, and there was still snow on his helicopter ride. And then, like, I was at the time setting up a heat rehab for one of our calls. We were setting up rehab. It was like 100 degrees heat index. I was like, wow, it's crazy across the country, the varying weather people are dealing with. No, double tap the screen. I learned something, so. So me, busy. It's a busy time of year for us. So EMS is busy. We're getting ready to add on a couple of ambulances and 2 new units to our system. So trying to get those online, and then medical gear, trying to work through all things that come with owning a business, and then working on social media. So just busy. It's basically like having 3 jobs. It's busy. So my son competed in his first jiu-jitsu competition yesterday. Did good. He's only got a couple months experience. Went against a high school wrestler, and then went against a 27-year-old. He's only 17, so did good. So I'm proud of him for competing. So this is what we did all day yesterday. We were in a hot gym with a jiu-jitsu tournament, so it was good. Let's see. Yeah, it's kind of messy, Sophie, but yeah, different guns all popped up there in the videos. CMG right there is one of the new ones. That's the 338 ARC, which is a cool one. 5.56 built there. So just got a new suppressor in that's going to be brand new to the market. I'm excited about it, to do a review on it. So suppressors, come off the NFA and all that, are not going to come off the NFA currently. So, but it's about a week turnaround right now. So see, hey brother, have a great Sunday. I was impressed with the videos and tips. Thank you. Awesome. Appreciate the prayer. Definitely. Just, it's a hard season for us. Like, my wife and I were talking about it at lunch, went to lunch, and with 2 teenagers, it's just, this chapter of life is hard. I feel like there's always a new chapter when it comes to being a parent, but this chapter is hard. So I'm ready for a new chapter. Germany. Awesome. Thank you for watching. And grid down, any thoughts about emergency dental care? Oof. It's going to be tough. Think about like medicine-wise, this is going to open up a crazy box, but like essential oils. So closed bud is great for numbing, for pain management, especially in an oral situation. So if you do have a tooth that's come out, things like that, you're having tooth problems, then I think about some way of numbing those pains, because those nerves are exposed inside where the tooth was. So some kind of numbing, but closed bud, like that stuff works. Like it's an essential oil, but like when I've used it, like my whole side of my face goes numb. So I think about something like that probably is the biggest thing I would look at. Some way to keep, some numbing, some pain meds, local anesthetic, stuff like that. Temporary fillings work, yeah. If the tooth is still in there, we actually teach just to put the tooth back into place and bite down and hold it in place. But I don't know how long you can actually do that. Like if you could not get to a hospital, get to urgent care, get to a dentist, something like that. So, but if we're taking someone to the hospital and we can put the tooth back in, we'll actually just put it right back in place and tell them to bite down a piece of gauze. Thoughts about people with no medical training moving patients after an injury. Arrived to a lady backwards on the ground in a wheelchair looking awkwardly, but I couldn't get people who were scared to move them. Yeah, typically 99.9999% of the time it's fine just to move them, especially if they're uncomfortable. Like there's nothing wrong with that. Like if they're up on their back looking up at the sky or just twisted up, yeah, like you can move them. If they're going to have a spinal cord injury, it's going to happen the moment of impact. And we do more movement, getting them on the stretcher, stuff like that. So especially if they're in danger, absolutely 100% chance you should move them. If they're with this heat outside, like I would move someone out of the heat, move someone out of the roadway. They can cause burns, stuff like that. But typically it's not a problem to move someone. I know people do freak out about their back, neck and back pain, stuff like that. But we're getting more and more relaxed on those. Got to hold them in perfect C-spine with backboard and C-collar. Those rules are kind of going away. Good question, though. I think people are just scared of getting sued. And I think that's where the Good Samaritan law comes into effect, things like that. So, can I have a gun? Sure. Just type in your credit card number across the screen, and I will punch that in and get your gun shipped out. That's going to get me kicked off of the live right there. Yeah, we're not selling guns on this live chat, so don't kick me off YouTube. Yeah, no, like especially yeah, especially in the summertime, and you can get some severe burns from the asphalt concrete laying there. So either put some kind of shade up over there if people don't want to move them, like silicone shave. Then you can cause burns. So yep. So yep, I saw your comment. Like you're trying to pick a fight because I didn't serve. I've never claimed to serve in the military. Straight paramedic, straight out of high school. So I don't know what your point being is, but we're good. Thank you for your service if you served. Have an opinion on what's a good gun choice. There's lots of good guns on the market, like whether you're talking about rifles or pistols, lots of good stuff coming out. So I always recommend people go to a gun range that you can rent guns, things like that, or find a friend who's got some guns and go shoot what you like. Everyone has an opinion. SIG, Glock, Smith & Wesson, all those, like they've got an opinion on what they are. So shoot what you like best, what fits in your hand, what you like, what you're comfortable shooting. Do you want a safety, no safety? Do you, full-size gun, subcompact, whatever you want. So go to a range and shoot, and you can shoot whatever gun you like. Because everybody's got an opinion. Like, I'm a Glock 19 guy. I know it works, and that's what I'm going to carry. Awesome. Good conversations. What else? Any other questions? You guys want to talk about stuff? So tourniquets always placed high, or is it okay to place them right above the wound? So a couple of thoughts about that is typically what I tell students is if you have time to breathe, you're like, I can take a breath, let's expose the wound and put a tourniquet on. It's a couple inches is just fine. Like go a few inches above the wound and you can apply a tourniquet and you're good. If you do not have time to breathe, you're like, I can't breathe, I'm panicking for whatever reason. There's bullets coming by, there's cars coming by, it's 2 o'clock in the morning, you're down a ditch, whatever. If you can't breathe, put it high and tight and we'll fix it later. Put it, as high up on top of the skin or on top of the clothes. Don't have to worry about going skin to skin contact with that, but then do that. And then once you get time to breathe, you can always reevaluate it and go, all right, this doesn't need a tourniquet, or I can move that tourniquet and go that way. So cool, Nate. Thank you for the pew wall comment. But yeah, you can put a tourniquet high and tight, but if that's if you can't breathe, you're panicking. For whatever reason, there's guns, bullets flying by, or there's fire, or there's cars going by you. But if you can breathe, take a second, expose the wound, put it on a few inches above, and you're good to go. Thanks for scrolling by, Nate. Good question, MS. Good job. Is NAC good to take for your lungs? I'm not familiar. I have to look that up. Like, I don't, honestly not super familiar. Here. Nate, have I ever applied one in a high stress environment? Yes, I have. I've put on probably 6 or 7 tourniquets in the field. Some of them I could breathe and no big deal. But I've had to put one on when the officers are still shooting rounds, like still trying to shoot the bad guy. So yeah, it's not fun, but I've been there. Most of the time though, I can breathe. It's on the side of the road. It's in someone's house. Cut it with a saw, something like that. So not a typical big deal. Quick gun question. Okay, in Australia has fun laws that means no mass shootings in decades. Okay, why do you prefer the dead? Andrew, I'm not gonna really get into a gun discussion with you, but I think we have stuff here that we're going to stop mass shootings. A good guy with a gun's going to stop it. So enjoy information videos. So, thank you, Biker Doc. Appreciate the comment there. Do you have a Glock? Yes, have several. Typically, the Glock 19 is my go-to for concealed weapon, things like that. So got multiple versions. Got a Gen 1 Glock still hanging on the wall. I like that one. Just the old school Gen 1, and then got Gen 5. So with the MOS, like that's my gun I carry for the SWAT team is the Glock 19 with the MOS. So that's my gun. Cool. What else kind of medical questions do you have? Yeah, I think you're going to have mass stabbings, people setting people on fire. So I think we live in bad people. So we're sinful people. So it's always going to be evil out there. Got my first target. Cool. Thank you. Appreciate it. Which one's the most expensive one? Man, that Glock 19 MOS one. So I don't know, probably the one that has like the Gen, I think it's Gen Z. Or what's trigger? It's got a trigger in it. That one's pretty expensive. So it's got a barrel, some of that. So that one's pretty nice. Okay. So been told not to use quick clot powder in older patients. There's no really evidence to support that. Like if we're looking at evidence, the data there's not really anything to support that. So if, but sometimes like Celox Rapid says theirs works better in that elderly population because of the way it prevents or starts the clotting process. So if someone's on blood thinners, things like that, Quick Clot says theirs work better. I've used Combat Gauze in older patients and it worked just fine. So, but there's really no evidence to support that signs of a stroke. Glock 19 pairs well with 2000, sub 2000. I've never owned one of those guns. Like it's always been on my bucket list, and never picked one up. So, which type of ifact do you prefer? A ripoff or more like a drop leg? So, on my SWAT vest, I keep an ifact right here. It's on the front panel because we don't carry magazines and that on the SWAT team for the medic. So I have my ifact right here. It doesn't tear off. It just opens up, kind of like clamshells open. So I like that because my tourniquets are really easy to get to, and it clamshells open so I can look down, get my chest seal, get my decode needle, chest seals, gloves, whatever I need is kind of in there. I also run a smaller back one on my battle belt. The back is an AR-500 ifact, so I can pull that loose to have it. But once you pull that out, you're never getting it back in. So, which is fine. If I deploy that, I'm probably not worried about getting it back in there. So I like that. Like to me, like that's the setup. We all of our SWAT medics run that as a clamshell open front and then one on the back. So I kind of like that. I'm not a big fan of a drop leg, just because I'm trying to get through a door. There's already so much on my side, whether it be a pistol or something like that. So pistol, radio, like it's just trying to get through a door. You don't want to be banging into stuff. So I'm not a fan of drop legs on the ifact. Do you have any experience with a ifact? No, I do not. I know they've got some research and some data from their company that they has said it saves lives. I have not seen it in person, so can't really judge it. I think it would be difficult getting a seal on those because, especially kids, their faces are so different, so size dependent on getting a good seal to get that airway clear because you like put a mask over it, pull it. I have not. So I think the Highland maneuver, hold them head down, back blows, chest compressions, because typically a PED's airway is going to be narrow at the top. Like ours is like this, so food gets crap down in there. But theirs is more like this. So stuff just kind of sits on the top of it. So in theory, it's not very difficult to get them from stop choking. Ton, cool. Nice to meet you. Thanks for stopping by. And Nifty is a new nasal spray drug for anaphylaxis. Interesting. Oh, I have not seen that. So this is like I assume it has some kind of form of epi. Like, I've not seen that. That's interesting. The absorption rate, is fairly decent in the nose and nostril area. So, but I'd like to know what medication they're using for anaphylaxis. Like, because spraying epi up your nose, I don't feel like that's probably beneficial. That's going to cause some vasoconstriction in your sinus cavity. So, I'd look it up though. Oh, with prescription. Still though, I'd be curious to know what medication they're using for it. What's inside of it? Sounds helpful. Sounds beneficial. I'd like to know like why it is, like what makes it better, like an EpiPen. Like people have prescribed EpiPens, they stab themselves in the leg. So I would like to know what the difference is there. So interesting. Thank you. Everything revolves around the dollar. Like everything, what are we talking about? It comes back down to money. So yes. Stab wound, upper torso, chest seal. Like I assume you're talking about here to here. So yes, that's a chest seal. Vented chest seal is typically what we're looking for. If you start getting up into here, then we're looking at maybe need to do some wound packing. We've got blood squirting out because you do have some arteries and veins that kind of run through here. So kind of looking at there. If it's bleeding, we can wound pack it. If you're seeing bubbles, things like that, or you think it's anywhere here, and I think a chest seal, absolutely. It needs to be bigger than 3/4 size of your trachea to actually be a true sucking chest wound. So, but a chest seal, vented chest seal would be great. Abdominal, yes. Like if you've got a stab wound that we're seeing here, just go a chest seal on it. It's not gonna hurt anything. You're not gonna wound pack the abdominal area, the back, so you're not gonna do any wound pack in there. So chest seal. We've seen a couple of times where people got shot here and it goes like in, it goes through the diaphragm, and then it ends up in that abdominal area. So you still could have some air leakage, stuff like that. So chest seal is just fine over there as well. My PE teacher said you never pack a wound because of infection and pain. He also said that he was a paramedic. Doubt it. So typically we're not going to wound pack the abdominal area, but like we can wound pack where there's muscle, like when you're pushing against muscle and bone, you can wound pack that. So arms, legs, shoulders, pelvis, you can wound pack that. You're wound packing that muscle cavity next to the bone, kind of pushing, compressing that vein artery that's bleeding. And so, yeah, you can wound pack that. Absolutely. Is your patient going to get antibiotics? Yes, they're going to get antibiotics, which is fine. Some services, like my service, we may go and give you antibiotics pre-hospital anyway. We can do that. So we'll wound pack you. Everything's stable. We've got a nice long ride to the hospital. We'll give you some antibiotics on the way to go and get ahead of that infection. So, yeah, I mean, obviously you're going to have a risk of infection when we start wound packing, but you're also bleeding severely. So you've got to stop that. Do you have a Walter PB? I do not have a Walter. I had one, God, years ago, and then just got rid of it. So 45 ACP. So that's a 45. Yeah. Honestly, most of my stuff is 9mm now. I kind of had stuff all across the spectrum. You know, we had 380s, 9mm, 357, 9mm, 40, 45. I kind of consolidated a lot of my pistols down to 9mm, so that way I can stock up on ammo, and just have one big cache of ammo instead of having multiple calibers and having to buy all this ammo. So any RPGs? No, I do not have any RPGs. That would be cool though. If I had one, I would wait on NFA background check to get an RPG. That'd be pretty cool. So recommendations on a tourniquet. My go-to is the cat, being completely honest with you guys, straightforward. On my vest, my SWAT vest, stuff like that, it's gonna be a cat. Now, the ETQ tourniquet, the everyday tourniquet, I think if I'm going to church or something like that, or I'm in just everyday attire, that's a good tourniquet. Like I like that one. It's small, compact. They make the sleeves too. It kind of slides in. So like I'm wearing blue jeans right now, and I could put that tourniquet on in my pants and have my Glock 19 concealed weapon, and you don't know I'm prepared. So I think the everyday tourniquet is good for every day. But if it comes down to my SWAT vest, I'm gonna have a cat. That's just my opinion. Cool, thank you. A lot of years in the making to get this collection look like it is, so thank you. Awesome. A few more questions. We're going right at 30 minutes. So last week I did a 30-minute live, and then right at 30 minutes now. So we kind of finish up. I appreciate the super chat there. Appreciate that, and then appreciate you guys giving a thumbs up. Yeah, I think everybody should carry a tourniquet. In the UK, you see a lot more stabbings. Obviously, we're talking about a lot of stabbings. You have car accidents still, wrecks, accidents with saws. So yes, absolutely. If you're in the UK, you should carry a tourniquet. Fortunately, I can't ship you one. We have contracts here saying that we can't ship outside the US, but find someone in the UK and buy a tourniquet. I mean, we think about gunshot wounds, stabbing, all that stuff for tourniquets, but it could be you're working with a chainsaw, you're working with an axe. So I think absolutely you should have a tourniquet close by. Cool. Thank you. I hope you have a great weekend too. Like I said, right at 30 minutes. So my plan is to do it next Sunday. We'll see. I know it's July 4th, but if I can do a 30-minute live chat on Sunday afternoons to talk to you guys, appreciate it. Thank you guys for subscriptions. Thank you for subscribing to the channel. Thank you guys for supporting us at Medical Gear, medicalgearoutfitters.com. So if you're looking for an ifact, any kind of medical supplies, and you're inside the United States, go check us out. Appreciate it.